Thank you, Dr. Sammy. And thank you all for the opportunity to share some of my work with you. I'll move a little closer here. As Dr. Sammy mentioned, I am an assistant professor in public health and also in Chicano Latino studies. So today I'm going to be talking about restrictive ID policies and their linkages with health inequities, as well as community-driven strategies to disrupt the connections between IDs and health. And I'll largely be drawing from an example of a partnership involving myself, my community research partners, and academic research partners back in Michigan. So before I dig in, I'd like to acknowledge my collaborators and co-authors. Contrary to typical academic fashion, I usually present on this partnership with at least 2 or 3 of my collaborators, as you can see in some of these photos. So I want to begin by acknowledging them, each of whom have been really critical to moving forward this work. First, I want to thank Kita Cowan, who is the CEO of Synod Community Services and who really is the life and breath of the ID project that I'll be sharing today. And also thank and acknowledge my colleagues William Lopez, Nicole Novak, Olivia Tamrowski, Maria Ibarra-Freire, and Jorge Delva, among others. So I want to start by asking you all a question. What are some examples of when someone might be asked for an ID? And you can just offer this up to us. What are some examples? You can even think back to when you were recently asked for an ID. I see a hand. When you use a credit card, so to purchase something, you might be asked for an ID. Yes. To purchase alcohol, yeah. So you probably need to verify your age in order to get the alcohol.
In some states, to vote.
Right, to vote, right? You have to show that you are registered in that locale in order to exercise your political right to vote as a citizen. Yes, others? Yes.
Airport.
The airport? To literally get through TSA and to board a plane, now we need an ID, absolutely, and I'm going to come back to this theme in a moment. Others? Andrea?
Receive medical assistance.
Medical assistance, right, absolutely. Increasingly, there are laws that are heightening the need for an ID to get health care. Any others? Yes? Dealing with law enforcement. So maybe identifying yourself to a law enforcement official, great. Wonderful, these are really important examples, and I hope that you will hold on to this question and these examples and continue to think of others as we move through this discussion today. So nationwide, about a decade ago, an estimated 11% of US citizens did not have a current, unexpired, government-issued photo ID. And this constituted about 21 million people, 21 million citizens of the United States. Among these citizens lacking an ID, non-Latino Black adults, Latino adults, adults with household incomes below $35,000, and older adults tended to be disproportionately affected by lack of access to a government-issued ID. And other communities are also affected. So particularly recently, undocumented immigrants are barred from accessing government-issued IDs in most US states. Additional communities are also affected. So folks who navigate residential instability, homelessness, or catastrophic events, like a fire, a natural disaster, or domestic violence, might not be able to prove their residence in a particular area and might have lost their identifying documents in those experiences. Additionally, health status, structures, access to IDs. So folks who are, have a chronic mental illness might also experience residential instability, making it more difficult to get an ID. Government-issued IDs require a person's legal name and biological sex assigned at birth. So transgender individuals might encounter difficulties acquiring their IDs when their gender presentation does not match their sex assigned at birth. Additionally, those in older adulthood encounter a number of challenges. So older Black adults who were born during the Jim Crow era may have never received a birth certificate that verifies their identity and their citizenship status, or they may have, but they may have lost these documents over time, and they may have been born in hospitals that were segregated and are now closed. Additionally, older adults tend to not renew their driver's license when they retire from driving, something that's of increasing concern with increasingly restrictive ID-related policies. And then finally, formerly incarcerated individuals are often released from prison without documents that would be necessary to get a current government-issued ID. And this really enhances the barriers for reintegrating in their community. Additionally, there is evidence that indicates that people of color are carded or asked for an ID more frequently than their white counterparts. This really highlights the urgency of this issue and ways in which it disproportionately affects communities of color. So this map is from 2015, and it illustrates the U.S. states that offer driver's licenses or state IDs to the residents regardless of their immigration or documentation status. So the states highlighted in green issue these IDs to residents. At the time, there were 10 U.S. states that offered IDs regardless of documentation status, California included. This is a pattern that's relatively recent in many states and has unfolded after several post-9/11 federal policies, one of which is the Real ID Act of 2005. And I'm going to just tap into a couple of policies as they relate to making IDs harder to get and increasing the instances in which we tend to need IDs. So the Real ID Act established a national standard for identification credentials, mandating proof of authorized U.S. presence in order for state-issued IDs to be used for federal identification purposes, like, for example, going to the airport and traveling for work or pleasure or family reunification. This act, unfortunately, burdens states with issuing IDs that meet these criteria, and as reflected in the map that I just shared with you, a lot of states have interpreted this in relatively exclusionary terms. So the Real ID Act and state responses to the Real ID Act really render verification of an affirmed identity as a government-controlled resource. In Michigan, where the partnership that I'll be sharing with you all is based, in early 2008, in response to the Real ID Act, the state began denying state IDs and driver's licenses to residents who could not prove their authorized U.S. presence. And licenses or IDs are typically renewed every few years in most states. I think Arizona is one of the few outliers where you can have your ID for decades. And a small minority of residents were particularly affected by this policy in early 2008, but it wasn't really until 2011 or 2013 when folks were turning out to renew their IDs and their driver's licenses that we began to see more and more residents with expired state IDs and expired licenses. And these residents experienced heightened barriers to trying to renew or tap into these IDs. So the Real ID Act intersects with several other policies to really heighten the individual and the community costs of restrictive access to government-issued IDs. So not only are IDs harder to get now, there are also multiple instances in which folks need IDs. And I'll just point to one policy example. So the Patriot Act includes a customer identification program, and this mandates that financial institutions implement policies and practices to verify the identities of their customers. And in response, many creditors and banks and creditors like utility companies have implemented policies that now require government-issued ID. Often, this is interpreted as a U.S. passport, a state ID, or a state-issued driver's license. And these are increasingly needed to do things like opening a bank account, cashing a check, or even acquiring gas and electric utilities. There have been similar such interpretations of these policies pertaining to medical identity theft that have prompted healthcare providers and administrators to ask for government-issued ID before even providing healthcare-related services and when billing for services. So this really is an issue that cuts across multiple sectors that are intimately linked with health. However, I want to really point out that these policies allow each institution to exercise discretion in determining the types of ID that are required. So these policies are really compounded by financial institutions and healthcare institutions' exclusionary interpretation of the identity verification measures that are outlined in this aspect of the Patriot Act. IDs are important, as you all pointed out, in a wide range of ways that we often take for granted. So not only is a driver's license used for driving, or a state ID used for perhaps rare occasions when you're asked to verify your identity, but IDs are also now really needed when purchasing or acquiring goods and services with a debit card or a credit card, or even when writing a check. IDs are needed when opening a bank account or applying for a loan. They're also needed to apply for or get a job or to access governmental records like a birth certificate or a marriage license. IDs are also needed to obtain healthcare resources, like identifying oneself to a healthcare provider or even getting medication at a pharmacy. I don't know about you, but in my household, Claritin D really gets us through allergy season, and you even need an ID to get Claritin D. Additionally, without an ID, it can be difficult, if not impossible, to access a host of community resources like a library card, which not only gives you access to books, but also the internet, and can really disrupt some socioeconomic inequities. IDs are often increasingly needed when trying to tap into nutritional assistance through food banks, for example. IDs are also needed to fulfill caregiving responsibilities. So oftentimes now caregivers are required to present an ID when picking up a child for whom they care. And IDs are also needed to access a host of resources for children themselves. Increasingly, IDs are also needed to access housing, so to even view an apartment or to verify one's identity as it's spelled out in a lease. Or to apply for a loan. A topic that is sort of a recurring theme around political seasons is that IDs are needed in many places in order to register to vote or even to vote. And then, as someone mentioned, IDs are often needed to identify oneself to police. So IDs can really shape whether or not someone has the opportunity to remain in the United States with their family and their community if interactions with police escalate to, for example, interactions with immigration enforcement for undocumented communities. So a robust literature really links several of these resources with health and health equity. And so it reminds us that ID policy is health policy. With the water crisis in Flint, we saw that residents had to show an ID in order to get even bottled water or water filters at distribution centers, which really reminded us of the salience of this issue that needs greater attention within the field of public health. Again, reminding us that ID policy is health policy and it's health equity policy as well. In response to several restrictive state ID policies, communities are developing IDs for their jurisdictions to mitigate the effects of some of these policies. And so I'll now move into thinking about that a little bit. So this is a map that's a few years old now, but I think is still useful for showing us at least the distribution of immigration policies at the local level across the United States. This includes some inclusionary immigration policies that were proposed or passed over this 5-year time period. The inclusionary policies are indicated by blue dots or blue shading, and the exclusionary policies are indicated by the red dots or the red shading. And this map and even this political moment really remind us that what's unfolding at the local level may serve to maintain, to challenge, or to improve the status quo of groups who are marginalized by federal or state level policies. So there's a lot of action at the local level to really strengthen and resist state and federal action. Several years ago in Washtenaw County in Michigan, Synod Community Services, which is a nonprofit social service organization, worked with a client who had very advanced diabetes and who had lost all of her identifying documents. As her condition required a lot of management, both on her part and of friends and family and the healthcare system, she needed to see a doctor to discuss her medical regimen. But without ID, she could not see her doctor. So Synod worked tirelessly to identify a strategy to get her an ID, but they encountered this really complex cycle of needing an ID to get an ID. So for example, to get a state ID or a driver's license, she needed her birth certificate. But to get her birth certificate, she needed a photo ID. So this really opened Synod's eyes to the complexities of a host of federal and state level policies that were unfolding at that time and that were intersecting in really important and complicated ways. So Synod began a stakeholder analysis, really connecting with other affected communities and with representatives to listen to and learn about their experiences with these federal and state level ID policies and to work towards a solution. As this process evolved, the partners identified the need for a local government issued ID to really disrupt this connection between federal and state ID policies and access to social and economic resources. So the partners formed a task force that included representatives of the affected communities as well as a number of institutional stakeholders. This included the governmental institutions that would eventually be provisioned with issuing the county ID, so the Office of the County Clerk. It also included representatives of the governing body who would need to approve the policy, so a representative of the County Board of Commissioners. It also included institutional stakeholders who deal with IDs on a regular, if not daily basis. As an example, the County Sheriff's Office was an active member of the task force and really saw the need for enhanced access to ID-related policies. So the task force met regularly over a 2 to 3 year period, and in between these meetings, a subset of the members of the task force would move forward the work and address the questions that came up as they worked to balance the needs of the affected communities and a host of institutional stakeholders. So at that time, I was working with some other colleagues on a qualitative study based in Detroit to really examine the intersections of federal and state restrictive ID policies as they unfolded in this northern border community. And a grounded theory that was really emerging at that time in this work was the critical role of state ID and driver's license policies in these immigration processes. So my team and I had several opportunities to really share this work as it was unfolding to inform understandings of the many facets of life in which IDs are increasingly invoked. So at that point, I and several of my other colleagues doing similar research really engaged in strategies to support this local ID initiative that was emerging. This included, for example, continuing to share our study findings as they were evolving, so before they hit press, and attending fundraising and other events that would really support the financial costs of the ID and gain buy-in related to the ID. So in November of 2014, the Washtenaw ID Task Force brought forward the county ID proposal for a vote by the county commissioners after we had really worked through a number of concerns across affected communities and institutional stakeholders. A majority of the commissioners voted in support of the ID, and the policy was passed and a more formalized vote was taken a few months later. So after the policy was passed, the task force then worked very closely with the Office of the County Clerk to address details regarding the implementation of this policy. And in June of 2015, the Washtenaw County ID became available to all residents in Washtenaw County who could prove their identity and also affirm their residence in the county. And this really provided a very unique opportunity to evaluate the health implications of a community-driven intervention to disrupt restrictive ID policies, and specifically to evaluate a community-level policy. So here's an image of some members of our evaluation team. And this process really culminated in a dynamic, mixed methods, longitudinal, community-based participatory evaluation. There is a lot that I could unpack there, and so I'm happy to explain more in detail during the question and answer period. But our evaluation team included community research partners and academic research partners and several graduate and undergraduate students who are critically important for moving forward the evaluation. This community-based participatory evaluation was really motivated by several lessons that we learned along the way of doing our research around immigration policies and what it would take to pass a sustainable local ID policy. So first, we learned that though this model of a local government-issued ID was not new, there wasn't a lot out there in the peer-reviewed literature or even some of the gray literature around past communities' experiences with local IDs. So what did they learn along the way? What did they do? What might they do differently? And importantly for our stakeholders, did it work? Additionally, my academic colleagues and I, who were working on similar issues, realized that there wasn't much in the public health literature, that this really wasn't on the radar of public health practitioners and researchers around IDs and equity, and we really wanted to contribute to this body of evidence. And then finally, we were all excited about local ID policies as a strategy of intervening upon what we were experiencing as a very restrictive context. And we wanted to lend our local experience and our research-related expertise and conviction around this issue to evaluating the Washtenaw County ID policy with the hopes that this might inform or be informative for other communities considering a similar such intervention. And then as a side note, as someone within public health, we're often trained to think of interventions as those that emerge from the academy. And for me, this was really exciting to be able to evaluate an intervention that was truly community driven. Another side note is that a lot of the relationship building and the mutual interests and the questions that guided our work were born out of small cumulative conversations that we had at a host of community and fundraising events and a lot of celebrations to celebrate the accomplishments along the journey of the passage of the local ID policy. And successful community-based participatory research really involves a lot of activities that are, quite frankly, invisible oftentimes to the academy. But this is really the space where the projects are born out and sustained. So I just want to note that before transitioning into what our evaluation has looked like. So the goals of the evaluation include considering the linkages between IDs and well-being quite generally. And we were also interested in establishing whether or not this county ID works for ID users, and if so, if it improves health. And with a health equity lens, we were interested in understanding for whom does the ID work and under what contexts. Additionally, we are interested in understanding the pathways by which local ID policies might shape health, including, for example, improved access to service-related needs and to a host of social and economic resources, a potential reduction of day-to-day stressors, and enhanced feelings of community inclusion. Our evaluation partners include community research partners from Synod Community Services, which has been the lead organization of the Washtenaw ID project and the Washtenaw ID task force, as well as the executive assistant at Synod Community Services. Our academic research partners include myself, so here now at UC Irvine, as well as 2 postdoctoral research fellows at the University of Michigan and a faculty member at the University of Michigan School of Social Work. And then we've also regularly shared and received feedback on our evaluation activities and findings from the Washtenaw ID task force. And then when appropriate, Synod has reconvened with members of the affected communities to share updates on the policy and to learn about residents' concerns and to let them know how the evaluation is progressing. And these conversations have really guided a lot of our evaluation activities. Our evaluation team meets about monthly to discuss the ongoing evaluation activities and updates with respect to the ID. Each member of the evaluation team has and actively uses our Washtenaw County ID. So we can also speak very personally to our experiences of using the ID, and we're very connected with some of the affected communities. So we've learned along the way of how they're trying to use their ID and if it's working and under what context. So we often bring these updates and these community concerns to that space and to that meeting. So I'll now just provide a very brief high-level overview of our longitudinal evaluation design and emphasize that this is a very dynamic process. So to address these research questions, we're really using this 3-part longitudinal design. The first 2 components involve interviewing participants at 2 points in time, and then the third component involves mystery shopper study in this third wave. So during wave 1, we conducted interviews with residents who got their Washtenaw ID within the first 6 weeks of the policy's passage or availability. And we used both closed-ended and open-ended questions to understand who was turning out to get their ID, where they'd experienced barriers to accessing resources based on their ID status, and where they intended to use their county ID. As part of this design in the second phase, we re-surveyed folks 6 to 8 months later, really allowing us to compare change over time within the same individuals. So what did our data collection process look like? For data collection, the research team were literally the data collectors. So we were in our ID Me t-shirts at the office of the county clerk when the IDs were being issued. And we were there ready to really talk with and survey and interview folks who turned out to get their ID. A lesson that we learned very early on was that no one in the office of the county clerks was bilingual. And all of our data collectors were bilingual to some extent. So we quickly turned to prioritizing getting access to the ID and disrupting some of these institutional barriers. Those were our priorities. And then on the side, when there was a little bit of downtime, we would survey and interview folks to understand in greater depth some of their experiences. So the study volunteers literally also helped with folks getting access to their IDs. The survey and interview participants also received an incentive for their participation, which theoretically may have helped to offset the cost of the county ID because they did have to purchase it. And a really beautiful and surprising outcome for several of us was that several participants opted to actually donate their study incentive to support the ID fund for residents who could not afford the ID. And so for me, that really reminded me that this was a very community-driven initiative with a focus on collective well-being and opportunity. As far as data interpretation and analysis, we tried to be quite dynamic in our process and to ensure that the evaluation data could really be used in real time. So as we collected the Wave 1 and the Wave 2 data, we provided bi-weekly summaries of a subset of the evaluation data. And this provided us with a sense of who was turning out to get their IDs and where they were hoping to use them. And then for the second wave, whether or not the IDs were working as we had hoped. We also use this as an opportunity to discuss our preliminary findings and to discuss important questions that we might be able to ask of the data, all with the goal of improving this local county ID policy. As an example of ways in which we really leveraged the evaluation in a dynamic form, one question on the baseline interview was the first place where participants plan to use their IDs. And we also asked a question where we asked them to check off the sort of activities or places, just more generally, where they plan to use their IDs. And these responses helped the ID project to then prioritize the institutions that they would reach out to raise awareness of the ID and to gain buy-in in these institutions accepting the ID. So as an example, overwhelmingly, residents reported that they planned to use their ID to get a bank account or to open a bank account. And so the ID project then immediately leveraged this finding to develop an outreach strategy specific to banks because it was important to us that the ID policy work well for those who are most affected. We also, sort of along the way, were reminded of who was not in this evaluation activity. So community members reminded us that there were a lot of folks who were not in our data set. Specifically folks who never tried applying for an ID, whether or not they had another form of government ID. And so this is something that we've definitely kept in the back of our minds as we think through this question of if the ID is working or not, and the communities that are turning out to get their ID as it might inform our outreach strategy. Additionally, we learned from follow-up surveys with participants and from accounts with county ID holders that the ID was working well for some folks and not well for others. More specifically, our non-Latino white ID holders who often presented as middle class qualitatively reported greater ease in using their ID than racial, ethnic minority, and lower income residents. So this was of great concern because we actively worked to ensure that the local ID was not racialized and not stigmatized, but the findings were suggesting that it was. So based on these findings, we identified a need to really leverage the third phase of our evaluation process in a way that could provide further evidence of variation in ID experiences in a way that might move us towards policy improvement. So what did this look like? So Kita, who's really been the lead on the ID project, had the genius idea of implementing a mystery shopper study to further corroborate this evidence as a strategy to then improve the ID policy. This is a really important example of how we've really tailored our process to meet the needs of this local context. So in December, we fielded a mystery shopper study of ID-related experiences. So we randomized women who represented the three largest racial groups in Washtenaw County, so Latina, Black, and white women. We randomized them to purchase a basket of goods that was already established, and then we gave them a very specific training on what they should do as they're purchasing their goods. This basket of goods included sparkling wine, and so because of the age of the shoppers, it was expected that they should be carded when purchasing this set of items, and we asked that they complete a post-shopping survey and verbal report, helping us to assess whether or not there was racial or ethnic variation in the experience of being carded and in acceptance of the Washtenaw ID. So what did we find and what did we do? So as we were collecting the data in the spirit of a very dynamic evaluation process, at the end of each day of this mystery shopper study, we debriefed with the mystery shoppers and collected the data from them. And we also debriefed as a collective evaluation team. Shortly after the mystery shopper study concluded, we provided a very brief summary of the emerging findings back to the broader evaluation team and the ID task force more specifically. And then we've discussed the implications of this for policy improvement with the sort of institutional stakeholders, so thinking about the Office of the County Clerk and the county commissioners. We're also planning for a series of community dialogues around findings from our evaluation more broadly, as well as this specific study, which sort of threw us for a loop. So our data-driven hypothesis was that we would find racial or ethnic variation in experiences of being carded or acceptance of the Washtenaw ID, but we found that there was a lot of structural space even within those activities. And so it presents a bit of a complicated story that we're trying to piece together through these multiple sources of evaluation data. And then lastly, from this third phase of the evaluation, we're really leveraging the findings to inform our business outreach strategy. So while we didn't necessarily find what we expected, a really positive outcome was that the ID is working pretty generally for most folks. So it is seen as valid, as tested in this one pilot mystery shopper study. So these data are useful in our outreach to businesses, urging them to accept the ID. So as I begin to close, I've talked a bit about dissemination strategies with respect to feeding our findings and our process and policy improvement back to the task force and, importantly, the affected communities. But I want to just provide sort of a high-level overview of some of our dissemination activities. So we are sharing our work in peer-reviewed literatures. We're also writing about the local ID in a lot of local news-related outlets. And we continue to stay in close communication with communities that are most acutely affected by restrictive ID policies, learning from them about continued policy-related concerns and sharing updates and evaluation findings. We've also been in conversation with several local communities, particularly after the election, about our experience and lessons learned as they consider whether a local ID is appropriate for their community. So the goals of each of these dissemination strategies is really to raise awareness of the Washtenaw ID, both within Washtenaw County and beyond the borders of the county, to improve the ID, and to share lessons learned, again, within the county and beyond. So on that note, I think that there are a lot of really rich lessons learned that I'd just like to share. So first, our partnership really reminds us that it's possible for research and advocacy to be mutually reinforcing goals. Our collaboration really values community knowledge in the process of understanding promising strategies to mitigate the effects of restrictive ID policies, and we're therefore contributing to research that's deeply informed by action. And we really value this notion of advocacy for the benefit of all members of our diverse communities. Second, while the task force worked diligently to ensure that the IDs were not stigmatized, resident stories really suggest that they have been stigmatized. So in looking more closely at the data, we noticed that many of the initial ID holders did not have a current US government issued ID when they applied for their Washtenaw ID. And so the ID project already had an ally and advocate program going, but this really taught us that we needed to invest a lot of our energies towards encouraging allies to get their Washtenaw ID and to actively use it in an effort to disrupt this racialized sort of process that was unfolding with the ID. Additionally, the ID project is thinking through sort of higher level policy strategies to destigmatize the ID. So third, as I mentioned, we were pleasantly surprised by the findings from the mystery shopper study, but we really needed to take a step back and reflect on how to reconcile these multiple sources of evaluation data as we assess this larger question of for whom does the ID work and under what context. So we had to think about how we communicate these findings back to community members who've always been our primary stakeholders in this work. A fourth lesson learned is that IDs and health equity is really not meaningfully engaged currently in the public health literature, although there are important linkages to health. So convincing my colleagues through the literature that this is linked with health from a structural determinants of health perspective creates a bit of a dance. And our evaluation methods have always served the partnership first and the academy second. As an example, in our mystery shopper study, there were a number of decisions that we made, and in order to really launch this study in an effective way, we had the shoppers purchase alcohol, right? And so much of public health focuses on lowering alcohol consumption. So it will be a bit of a dance as we convince our peers in the field that this is an important and worthy area of scholarship. Fifth, our community partners really have taught me of the benefits of partnering with individuals who are attached in some way to the academy. And they taught me that this has really been helpful for them in moving forward their work and enhancing at least the ascribed validity of the project. As an example, our community partners have mentioned how just simply talking about their collaboration with academics and the evaluation data that we've collected has enhanced their position in applying for grants. And their interest in the evaluation was really motivated by there being limited evaluation data available when they started this journey to the local ID. We all know that there will come a time when we need to explain whether or not the ID is working both to residents and to the policy makers. So there is this mutual interest in evaluating this ID policy to understand if it works. So our collaboration really makes this evaluation at the scale that we've conducted it possible. So as I really close, here I just want to note that there is a social movement at the local level to implement local government-issued IDs. This movement really started in communities like New Haven and Oakland and San Francisco, California, and has been spreading in the Midwest for sure, and I am sure in other smaller communities throughout the country. I realize that I share this example here in California where the ID-related policies are a bit more inclusive than in contexts like Michigan. But the Michigan story really reminds us that restrictive ID policies are literally one stroke of a pen away. So this, I would argue, is critically important research, and we must be vigilant and attentive to policy decisions and opportunities to disrupt them. And then finally, our partnership process may also teach us lessons about how community leaders and academic partners can work together to promote equity and to evaluate whether equity-driven initiatives actually work in the ways that they're intended. So with that, I'd like to just close by acknowledging my partners in this work, so the ID Project Task Force, the participants who are critical to these evaluation activities, the host of students who've worked on this, and our funding sources. And I'll open it up for questions and discussion.
Thank you, Dr. LeBron. Questions?
How long does it actually take to get one ID?
To like literally get an ID when it's available in your community. So in Washtenaw County, if you have all of the documents that you need, it can take just 5 or 10 minutes. There are a number of identity and residency verification aspects. So if you come with all of that paperwork and complete the application, if there's not a long line in the office of the county clerk who issues birth certificates and marriage licenses, then it can be a pretty quick and a pretty smooth process. Detroit, Michigan, and Johnson County, Iowa also have local government issued IDs, and they operate on a little bit of a different process. So people submit their application and their identifying documents, but then their IDs are actually mailed to them. So it might take a month to 6 weeks to get the ID. So it really depends on the local context. But in Washtenaw County, it can be quite short. For me, it took me several attempts because one of the residency requirements at the time was that you have a piece of mail in the form of a bill that has your name and your address, and that's dated within 30 days. And that became really hard to do. So for me, it took multiple times, so maybe 7 days or so. But once you have everything together, it's not a challenging process. Andrea?
What is the process for people who do not have the documents they need to apply for the ID? What happens to them?
So who traditionally might not be able to get like a state ID or a driver's license in Michigan, or who can't get like a Washtenaw County ID. So some of the biggest barriers for getting the county ID were really proving residency. So if we think about like someone who experiences housing instability or homelessness, how do you prove that you've lived in the county for the last 30 or 60 days? And there might be others who might be staying on the sofa of a family member, right? Or who might live or stay with someone else, but their name may not be on the lease or the mortgage. And so a really important aspect of verifying their residency and identity has been this notion of ensuring that folks can testify that they affirm the identity and the residency of someone. So that's been really neat when we've had someone come in and sign an affidavit of identity saying, I attest that this is my brother and he lives with me and here's my lease on my place. There have also been a number of strategies leveraged by social service sectors in Washtenaw County where if religious institutions or non-governmental institutions or even the health plan, for example, have these longstanding ties with their clients and their community, they can send a letter in attesting that they affirm this person is who they say they are. They are a member of our community in Washtenaw County, and that really helps with the process of affirming their identity and their residency in the county. Great question.
I'm not actually sure if you answered it already, but it was on the same line as hers. I was just curious about the process by which people prove their identity. When you explained some of it, was that pretty much all of it?
Yeah, so it's a pretty complicated process for proving their identity, and we would actually argue that it's pretty hard to prove your identity for the Washtenaw County ID. So I'd encourage you to check out washtenaw.id.com. All of the eligibility requirements are indicated there, and basically the way the identity and residency verification measures work is that folks can present sort of a range of documents, and they need to reach this 300-point criteria in order to get their county ID. ID. So one thing that's a little bit different from the state ID or driver's license context and requirements in Michigan is that folks can present an expired driver's license or ID, and depending on when it expired, it might be worth 100 points on that scale or 200 points on that scale. But we really operate from the understanding that, like, just because my license might have expired yesterday, my identity did not change, right? So we're really open to this idea and notion that when folks can present a host of documents, we can really leverage this as an opportunity to affirm their identities. Sure, yeah.
Have you had any luck in getting other counties to start the process of issuing their own IDs?
We've been in close communication with a number of locales in the Midwest who've explored the opportunity to have either a city or a county ID. We haven't necessarily been the sort of starters of those processes. It's folks who've come together around this interest and then connected with us. But we've very openly shared our story and lessons learned with the hope that the time from sort of start to implementation of the policy can be shortened for other communities. And we also hope that they really leverage a community organizing perspective, really working closely with affected communities.
We'll take one, maybe two last questions. Did you have a question and then back?
Yeah, my main question was, what was the main barriers to launching this program? Because it seems like you had great community involvement and they were active. You had a bunch of stakeholders, including the office and the clerk, the county clerk. So what were the main barriers to launching the program like this?
That's a great question. There were a number of concerns. For members of the undocumented community, for example, a major concern was, okay, I'm bringing my birth certificate, my expired license, proof of my residency in the county. What's happening with these documents and what's happening with my name when it's entered into this ID-related database? And this is a question that's recurring now in our sort of historical and political moment. The city of New York and a number of other locales have really grappled with this question. So one question was, what's happening with the information that I provide in order to get this ID, and what is the commitment on behalf of the Office of the County Clerk and the ID project more generally to protecting these data? So the task force really worked through a process of meeting those needs. And the other concerns were really around the validity of the ID and what it would look like, the information that would be contained there. So as an example, it was really important to several institutional stakeholders that the ID not look exactly like a driver's license or state ID in Michigan, but that it looked distinct. But then affected community members also wanted it to be seen as valid, right? Like not something that raised questions for others. So those were challenges that really required the task force to go back and try to learn from other successful examples and to balance the needs of multiple stakeholders.
One last question, please.
I was wondering if, you mentioned it was a community-driven intervention, and I was wondering how difficult or easy it was to get the county on board on how supportive they were initially versus later on.
They were very excited about this. I think that everyone involved in the task force understood the journey that they would need to go through in order to get a broader consensus amongst the groups. But this was an issue that several folks were very concerned about within the context of Washtenaw County and Michigan more generally. As an example, the sheriff was one of the staunchest supporters of the ID, right? Really pointing out that sheriff's officers deal with identity verification on a daily basis, and this comes with great costs to community policing. So he was one of the first folks who were on board with making it easier to engage with residents. But I think that the task force was under no illusions of the complexity of passing a policy just in general, and then this ID policy at the local level.
We could talk about this all day. I love everything that you do. It's such important work. To me, this is the essence of prevention work in public health. Can you help me thank Dr. LeBron?